What is vasectomy? Vasectomy is a method of permanent sterilization for men, and it's excellent for men and for couples who don't want to have kids anymore. What to expect on the day of the procedure? You can eat and drink before the procedure, and you can drive yourself to the procedure and from the procedure home, although it's always better when somebody takes you home. How is the procedure performed? The procedure is performed in the office under local anesthesia. We first clean the skin and we give a numbing medication. Just like you get numbing medication in a dentist's office, we numb the area that we're going to work on. We make a tiny incision on each side of the scrotum. We find the little tube that connects the testicle to the rest of the body. It's called vas. Hence, we call this procedure vasectomy. And we put clips on the vas. We excise a small portion of this tube and we burn the edges. Afterwards, we put everything back where it belongs and put a dissolvable stitch in the skin. We put antibiotic ointment and you're free to go. What to expect after the procedure? Numbing medication works for about 4 hours, and you are expected to feel very comfortable until the medication wears out. A mild to moderate pain may occur afterwards, and medications like ibuprofen and Tylenol should be enough to keep you comfortable. And as time goes by, the pain gradually will decrease. The stitch that is dissolvable will dissolve in approximately 4 days, and that's when the pain from the skin edges usually goes away. You can return to normal activity of everyday life after the procedure, although it's always nice to take it easy for next 4 days. I recommend not to engage in heavy, strenuous physical activity or sexual activity for 4 days, and then gradually increase the level to the level that you were before the procedure. What is important to understand after the vasectomy? The most important fact is that you do not become sterile immediately. It takes about 2 to 3 months to clear all the residual sperm cells out of your body. So after the procedure is performed, I will ask you to submit a semen analysis in 2 months and in 3 months following the procedure. And only after I see no sperm on the semen analysis, only then you can stop using your preferred birth control method. What are the risks of the procedure? Every time you break the skin for any type of the procedure, there are risks of bleeding and infection. In order to avoid bleeding, I ask you that you don't take any aspirin or any other blood-thinning medications. Blood-thinning medications include non-steroidal anti-inflammatory medications like ibuprofen or Advil or Aleve. And if you have to take aspirin or Coumadin or any other blood-thinning medications upon advice of your doctor, please let me know so we can arrange for safe transition. Every time a person has surgical procedure, there is always risk of infection. In order to avoid infection, we keep everything sterile, and I will ask you to use antibiotic ointment on the skin. You can apply it a couple of times a day until the skin heals. The pain from skin edges will go away in approximately 4 days after the stitch falls out. However, the heaviness and pain in the testicles may linger for a little bit longer. On average, the pain goes away in about 2 weeks. However, in some cases, it may stay for a little bit longer, and ibuprofen or Tylenol and scrotum supporter will help. What are the other risks? Sometimes the bleeding from skin edges may be more than average, and sometimes a hematoma forms. Hematoma is the collection of blood underneath of the skin. If the small hematoma forms, most of the times it will go away by itself. If a large hematoma forms, then a surgical procedure may become necessary to evacuate the hematoma and stop the bleeding. The pain may linger longer than a few days on the skin and a couple of weeks in the testicles. It may even become a chronic pain. Very, very rarely do we have to do anything about it, such as to perform a procedure to divide the nerve that supplies the testicle. And lastly, but importantly, sometimes nature finds its way back together. In approximately 1 out of 500 men, we can find sperm cells in the semen analysis even long after the procedure. However, it is more reliable than birth control pills, condoms, or even intrauterine device. It's as reliable as tubal ligation in a woman. However, doing a vasectomy in a man is a much less invasive procedure than doing tubal ligation in a woman. Overall, vasectomy is an excellent procedure for those couples who do not want to have children anymore.